Well, millions of families across Georgia rely on Medicaid and Peachcare for Kids for health coverage. And since the start of the COVID-19 pandemic, a federal emergency declaration has allowed them to receive continuous coverage without having to re-enroll or jump through hoops. But Georgia officials are warning that is about to change in just a matter of weeks. 11 Alive's Brittany Kleinpeter is live outside of the Department of Public Health, breaking down exactly what this all means. Brittany.
Good afternoon, Paolo. So right now, what they're telling people is just to prepare for a change in their eligibility. Now, as you mentioned, that federal COVID-19 public health emergency was put in place to make sure people had continuous care during the pandemic. The state is stressing once it ends, it will be required to reevaluate each and every person who has Medicaid or Peachcare for Kids and determine whether they're still eligible. Enrollment for Medicaid increased by over 30% since the start of the pandemic. That's more than a third of the state, which is now enrolled, and the majority of them are children. Nonprofit Georgia for a Healthy Future says it's worried about how this will impact millions of Georgia families.
Winding of these protections is going to be one of the biggest administrative challenges for our state since the Affordable Care Act rolled out. So it will be a huge undertaking. We expect that somewhere between 245,000 and 545,000 people will lose their Medicaid coverage. Many of those people will still be eligible, many of them children.
Because there wasn't a re-enrollment process during the pandemic, many families will be going through this for the first time in the near future. Georgia officials are asking people to prepare by updating their contact information through the DHS's benefit website or calling them. You can also go to your local DFACS office, and organizations like Georgia for a Healthy Future can also walk you through the process. Now, the public health emergency is in place till January 15th. We're told it's likely going to be extended, but there are reports that the Biden administration has told healthcare providers to prepare for it to end. Paolo?
Lots of good information there. Thanks so much, Brittany.